we present Synart, a personalized therapy for the treatment of degenerative and inflammatory conditions affecting all synovial joints, available in 5 different concentrations of hyaluronic acid: 80, 60, 40, 30, and 24 milligrams in 2 and 4 ml formats. Synart, with its ideal molecular weight, acts as a temporary substitute for synovial fluid and provides a dual action: viscosupplementation, which offers lubrication and mechanical resistance to the joint, restoring mobility compromised by wear or osteoarthritis; viscoinduction, which stimulates the synthesis of new hyaluronic acid by cartilage and synoviocytes, reducing inflammation, a longer-term effect that relieves pain, preserves cartilage, and protects the entire joint from degenerative damage. Synart, developed by the Italian laboratory Health-Pharmalabs, helps restore the rheological conditions of joints in degenerative or post-traumatic states thanks to its viscoelastic and lubricating properties. It is non-immunogenic, as it contains linear hyaluronic acid that is nearly identical to the endogenous version, produced through bacterial fermentation from Streptococcus equi,